general urologist and uro-oncologist and kidney transplant surgeon. Please, Dr.
I would like to remind
Hamad.
the speaker to be very strict about the time, 10 minutes each, and we will stop the speaker at the end of the 10 minutes. Thank you.
Yes, good morning, everyone. Assalamu alaikum wa rahmatullah. Chairpersons, thanks a lot. My name is Hamad Al-Hilu. I come from Salmaniya Medical Complex, and I will give you a brief, actually, about the organ failure, organ transplantation, our experience in Bahrain. Now, just for probably most of you, you know that Bahrain is that small country in the Arabian Gulf. It's part of the GCC Gulf cooperation countries, and it's functionally and politically related to this group of countries in the Middle East. Now, our population in Bahrain in 2010 was just more than 1,200,000. Now, 55% of these are expats, 45% are Bahraini national. Now, our population actually has increased or doubled over the past 10 years, from just above 600,000 to now 1,200,000. Now, the annual incidence of end-stage renal disease in Bahrain is estimated to be, as like the international figure, 120 per million in a study published by Dr. Al-Arayid in 2000. Salmaniya Medical Complex is the major governmental hospital that also harbors the transplant program. 80% of our end-stage renal disease patients, they have access to either dialysis or transplantation. In our institute, we have more than 250 patients on dialysis, and there are another 85 patients in the military hospital. Hemodialysis still is the major modality of dialysis. However, we have an ambitious peritoneal dialysis program starting in 2007. The estimated mortality that we have is 10% annually of those patients. Now, Professor George Abuna introduced the living-related transplant in 1995. And there was, as you can see, a lag of 20 years after its introduction in Saudi Arabia. And Dr. Sadiq Abdullah actually introduced the first cadaveric transplant in Bahrain in 2001. Now, since that time, since 1995, we have performed 108 in total, 88% of living and 20 cadaveric or disease. Due to the shortage that we have in Bahrain, patients are still seeking commercial transplantation abroad. Now, this is just to show you the number of cases. The green are the cases which were done outside, blue are inside. There has been a relatively golden period here. We started improving in 2010, and the problem here was that this program was mainly dependent on one person. That's why there was a sort of a collapse thereafter. Place of transplants, this is just to show you the countries which are doing cases outside. And as you can see that Iran and Egypt, they constituted the major areas for transplantation abroad recently. Most of the patients are Bahraini, of course. Few are non-Bahrainis. Majority are, or 2/3 are male, 1/3 are female. The mean age for the recipients, 40 years. Original kidney disease in our series is unknown in 44%. However, diabetes constitutes the major known factor in just more than 1/5 of the cases. Pre-transplant dialysis, yes, in the majority. Preemptive, only 15%. The survival grafts is pretty classical for both graft and patients. The outcome, as per this talk, we have 71 cases living with functioning grafts. The donor age is 34 years. The major source for transplant in our series is from siblings, 51 cases. Now, what are the challenges and the future plans that we have in Bahrain? Now, this is classical. We also face the same. Supply is much lower than the demand. Now, we have profound, actually, legislative problems, especially in regard to the cadaveric donation, some religious ones. We are suffering some low, let me put it in that way, low public awareness regarding transplantation that we are also working on. Kidney transplant to a minority group like pediatrics who don't have it in Bahrain. And introducing other solid organ transplantation is one of the known challenges that we have in Bahrain. Now, since the declaration in 2008, Bahrainis, they know this figure very well, 30,000 Bahraini BD. You can get, of course, a kidney till this time. So it's a popular figure in Bahrain. Now, all the risk of commercial transplantation we do get in Bahrain, especially surgical complications. We have patients coming with urine leak, drains, catheters. Now, what are the solutions? Training, working in our transplant center, and then getting local experience from regional centers. Now, these are few of the things. We have a new building very soon. We are recruiting full-time coordinators and training hours. We are working on management protocols. Regarding the trainings, our residents are going abroad to get their proper training in solid organ transplantation. And, of course, working our local training. However, this is the main stem of our plan. Now, there are a lot of good centers in the region. However, we recognize that we are very close to one of the really good centers. Now, this is King Fahd Specialist Hospital in Dammam. And now that's the distance between us and them, a very, very relatively short distance. Now, in fact, we are working on a real twinning process. Again, this has to be under the umbrella of the SCOT, as SCOT is the reference center for all of us in the GCC. We also view them as this. Now, what happened in 2010 is something, 2011 is something possibly beyond the scope of this meeting. However, it did affect the healthcare. It did affect all of us. Are we improving? Are we recovering? Yes. In 2011, we did only 4 cases of living transplants. And we have another 3 coming in the next 2 months. Now, in conclusion, the short and long-term results of kidney transplantation in Bahrain are encouraging. Availability of suitable donors is a major problem. Transplant tourism is still there among the Bahrainis. It does affect our outcome. Promoting public awareness is paramount to improving the program. Coordination with centers in the region will help in solving the problems. Now, this was the happy team in 2010. And we are missing one of the vital pillars of this team. Thank you.
Thank you, Dr. Hello. We will have the question at the end of the sessions. Sure. So we'll proceed with our next speaker, who's from Kuwait, Dr. Mustafa Al-Musawi. He's the head of the Kuwait Organ Procurement Unit. He's a consultant transplant surgeon at Hamad Al-Isa Organ Transplant Center in Ministry of Health. He's the vice president of Kuwait Transplant Society, and he's a member of Ethics Committee in the Transplantation Society and in the MISOT, and he's member of Council of Asian Society of Transplantation. He will talk about the status of transplantation in Kuwait.
Thank you very much, Muna. And so Kuwait is one of the smaller of the GCC countries with a changing population. Every few years, the population gets larger. Presently, it's about 3 million. 2/3 of these are expats from Arab and Asian countries. There are 7 dialysis centers with a single transplant center. And we have a transplant law which backs to 1987. Now, just the landmarks of transplantation activity in Kuwait. 1972 was the first law on eye bank, which basically just to regulate cornea transplants. In 1979, again, like in Bahrain, George Abuna was the person who started kidney transplantation in Kuwait. So the first related living kidney transplants among two brothers from Jordan were performed by Professor Abuna. In the same year, the first fatwa on organ transfer from the deceased and living appeared in Kuwait. In 1981 was the first deceased donor transplant performed, although the kidney came from abroad rather than a local deceased donor. In 1983 was the first law on kidney transplantation, so it was basically only for renal transplantation, not organ. In 1984 was the first local deceased donor transplantation and the first bone marrow transplant, and the Kuwait Transplant Society was established in the same year, and there was a feeling that, okay, and the first deceased donor pancreas transplants in 1985. In 87, there was a feeling that we need another law, so another law involving or talking about deceased donation and brain death appeared in Kuwait, and this law still functions till now, although I feel that we need to update this law as well. In 1989 was the first living donor pancreas transplant, not only in Kuwait but probably in the Middle East, and there was a ministerial decree regulating deceased donation. And in 1996 we started the organ sharing in GCC countries, and also started an organ procurement program, a well-established or a functional program. And in these pictures you see one of the cases which was shared between Kuwait and Saudi Arabia. And that visit by the Saudi team, Sayyid Majdi Yaqub, who was visiting Saudi Arabia at that time, was also part of that team, and he procured the lungs, the heart, and of course the liver was also procured and taken to Saudi Arabia, and then we used the kidneys in Kuwait. In 1997, we participated in the World Transplant Games for the first time in Sydney. And in 2001, we organized the first Middle East Transplant Games in Kuwait. And in the same year, a ministerial decree enforcing or making it compulsory to refer all brain death cases was passed in Kuwait, or was by the Ministry of Health. In 2003, we managed to get 2 gold medals and the silver in the Transplant Games and the World Transplant Games in France, and which was, I think, a very happy achievement. In 2005 we started, and we are still continuing with laparoscopic donor nephrectomy in Kuwait. So let us look at the transplant activity. Started in 1979, gradually picked up until 1990 when it collapsed because of the invasion of Kuwait, and then we started in 93, and gradually the program has picked up again, up and down, but it is viable, and we do a large number of transplants. We do, since we are the only center, we do children, we do adults, we do old age, and the youngest we have done is aged 2.5 years or 3 years, I can't remember. I think it was 2.5 years, and he's doing well so far. And the oldest I've done is 84-year-old lady who was transplanted many years ago. I think she's now approaching 90, and she's doing very well after a transplant. So this is the youngest, and then the oldest. Who are the donors? Now, before in the old sort of group by George Abuna, there were some imported kidneys from Eurotransplant. So these are in light blue, and very few deceased donation from local donors. After 1996, when we established an organ procurement program, the number of donors, local harvested donors, deceased donors, increased tremendously. And as you see also in yellow, the number of living unrelated donation has increased since we opened the door in the year 2000. Something I'm not very proud of, but I will be talking about this in my next talk in the afternoon. Now, how many organs we have procured from deceased donation from 1996 to 2000? So by the way, we have done so far until the end of the last year 1,601 transplants, Of these 155, we had 155 donors. The ages were variable from 2 to 61. And we took 359 organs, solid organs, 138 tissues. Kidneys used in Kuwait were 248. 2 pancreases were used in Kuwait. Corneas, of course, and some kidneys were sent abroad, either to Saudi Arabia or to neighboring Gulf countries. And we sent 56 livers to Saudi Arabia, and we got nothing in return. Thank you. Okay, 2010, we needed to improve the situation of the organ procurement because it was up and down all the time because it depended on the activity of the coordinator. And we thought that we really need to have a system which doesn't depend on a single coordinator. So an Kuwait organ procurement, COP, was started last year, and we are just in the process of training our coordinators. We have new coordinators, and then we also follow the Spanish model of having a coordinator in every hospital. And since then, we have also been reviewing what is the potential for organ donation in Kuwait. And over the last 1 year, we've had 4,349 admissions in the ICUs of Kuwait, and there are 7 major ICUs in Kuwait. 705 of them died, and 96, so nearly 100, is the potential, potential donors in Kuwait. And unfortunately, only 49 completed brain death tests, and this is something that we have to improve. And that is the importance of the statistics, to look and to study and try to improve. Why should we only half of them be completely tested? And of course, some of them were not brain dead, but there's a lot of delay sometimes in diagnosing brain death. And we approached nearly all the families who are available, and we got 10 consents, which is a small number that we have to improve. And we procured only 7. The 3 of them, there were various reasons, sometimes delayed by the surgeons, sometimes a cardiac arrest before, and so on. Thank you very much.
Thank you very much, Mustafa.
I just forget just to mention that we've been working on establishing a liver program for many years. There are still a lot of political hindrance or political problems within the ministry, but we hope that this will start in the next couple of years.
Thank you very much, Mustafa. And now we'll move to our next speaker from Oman, Dr. Isa Al-Salmi. He's a graduate from Trinity College, University of Dublin, Ireland in 1993. He has his MRCP in 1999, and he has his PhD from University of Queensland in 2008, and he has Master of International Public Health from the University of Queensland in 2009. He's a senior consultant and renal physician at the Royal Hospital since July 2010, and he is the chairman of the Committee on the Development of Treatment Services for Kidney Diseases in the Sultanate of Oman, and member of the Committee of Organ Transplantation Center within Oman also, at Qaboos Medical City. Please.
Thanks a lot, Mona. Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I would like to thank the organizer for inviting me to speak on behalf of the organ failure and transplantation status in the Sultanate. Unlike other countries in the Middle East, Oman before 1970, its health status really was not at all present. In fact, there's no medical services whatsoever apart from traditional medical issues. Until 1970, there was only one small missionary hospital really looking at infectious diseases. And the first medical hospital, which is more or less secondary in nature, was established in 1975. The first renal dialysis unit was established in 1983 and was in Muscat region, which cover all of the Sultanate. So people has to travel, but whatever methods to arrive to that particular place. Until 1988, transplant was not present whatsoever. So people who have some relatives were sent overseas, in particular to United Kingdom, to have their kidney transplantation done. However, in 1988, the transplantation program started, and immediately started with cadaveric as well as living transplantations. And subsequently, in 1992, the bone marrow transplantation took over. And this followed as well by both living-related pediatric and cadaveric pediatric in 92 and 94 subsequently. Though the WHO ranked Oman the 8th place in the overall worldwide because of health services, this was purely because of the concentration of the primary health service. And by concentrating on delivering immunization, and which reduced both the infant mortality and children mortality quite dramatically. In fact, the immunization was compulsory, which achieved 100%, and was distributed all over Oman. Every small areas with every small population has received a primary health care with full immunization, even it was being based on a caravans. We have done a number of screening programs in the late 1990s, early 2004, 2005, and the latest was done in 2008, 2009. About 40,000 people were screened all across the Sultanate, on those in particular age 40 years and over. Surprisingly, although not, 1% of the people had GFR less than 30 ml per minute per meter square area, based on the MDRD equations. 9% have a GFR between 30 and 60 ml per minute per meter square area. And almost 1/3 had a GFR with 60 to 90 ml per minute per meter square area. That's a mild renal impairment. The incidence of end-stage kidney disease was calculated of 120 million per million population per year that require at least one form of the renal replacement therapy or the other. So on average, there are about more than 200 cases per year that require renal replacement therapy, and based on their age and fitness, more than 50 of those will require transplantation. This number will increase by 10% on a yearly basis. As for the other organ failure, there is no accurate information at present. However, heart failure constitutes more than 1/3 of the medical admission in the Sultanate. In a similar fashion, liver failure accounts for about 10%. Respiratory failure is rare, and few patients really have home oxygen therapy. Yet diabetes and its complications are very common, and more than 20% of the population has diabetes, impaired fasting glucose, and impaired glucose tolerance. Dialysis started in March '83 with only one center. However, by this year, we have 18 centers all over the Sultanate, covering almost now approaching 1,000 patients. And till 2010, we have more than 3,300 citizens with end-stage kidney disease. Half of those has passed away, and over 800 still on regular dialysis, but this is increasing, and over 800 having a functional graft kidneys. So far what we have been doing is we're following 1,500 kidney transplant cases. We're following 150 liver cases, 2 heart, and over 300 heart valve, and over 500 bone marrow transplant cases. However, more than 50% of the kidneys are done overseas. All of the liver and the heart are done overseas, and only less than half of the bone marrow transplant are done within the Sultanate. The survival for those who are done within the Sultanate is quite good. Some of the achievement we have done is, we have the youngest kidney donors in the Sultanate, and probably the youngest worldwide. At 33 weeks, premature, born alive, was an encephalic, and his parents donated his kidneys to 2 children, and they are surviving very well. We have few only paired exchange kidney transplant done, and 2 blood incompatible cases as well. The latest we have done this year is a new record of 16-year-old who acquired bone marrow identical state from his sister after a bone marrow transplant, and because of the treatment of chemotherapy and radiotherapy for his leukemia when he was 2 years old, he was suffered from renal impairment, and he required dialysis by the beginning of this year. So in June this year, we have transplanted him with a kidney from the same sister, and he did not require any immunosuppression, as he was fully identical. In bone marrow transplant, doing quite well. We started in 1994, and we have increased the number of bone marrow transplantation, and reaching now more than 30. This number is expected to double over the coming few years, with the new center that's fully independent. Why the issue with transplantation in Oman and why people traveling overseas to have this transplantation? We have done a small studies with Dr. Nabil, and a questionnaire was distributed to over 500 of people randomly. Unfortunately, only 300 responded to this questionnaire. But at least 1/3 of those participants had a family member or a friend that have a kidney disease or has a transplantation. And 2/3 of those would not mind donating a kidney to a relative if needed so. Unfortunately, however, less than 50% of those knew that donation after death is permitted in Islam. And even 1/3 of those really would donate a kidney after death. The good thing is that the more educated they are, the more likely to donate. So what's happened in the overseas? From the early 1990s, many people would go to India. And in early 2000, they will go to Iraq. And from mid-2000, they will go to Pakistan, and that's increasing. However, in the last few years, in this 2000-something, China took over, and we are receiving more transplant cases done overseas than they are done in the Sultanate. So what's the way ahead? We have established now a new centers, which will be soon available in the Muscat region, and there will be another region done in the south side in Salalah region. We have a center that might care for over 100 beds, and they are fully supported. We have done already the donor card available for the people. We have as well approached the religious people and the authority to include all those willing in the license and the national ID. So in conclusion, in the last few years, the Sultanate has increased in transplantation in the kidney and bone marrow transplant. We are one of the rare countries in which the kidney transplant patient equal patient on dialysis. We have few distinguished contributions, but they are very few. This has resulted because of the negative impact of transplant tourism, and we hope this could be reduced by improving the life-related transplantation and by development of an effective disease donor program. Thank you very much.
Thank you very much, Isa. Our next speaker is from Qatar. He's Dr. Yusuf Al-Muslimani. He's a graduate from Royal College of Surgeons, Dublin, Ireland in 1988. And then he has his fellowship from the same university in 1993. He also achieved his fellowship in kidney transplantation at the Cleveland Clinic Foundation in 2001. He is the head of the kidney transplant section, the chairman of the organ transplant committee, and the chief of medical staff at Hamad General Hospital. He will brief us about the status of transplantation in Qatar.
Assalamu alaikum. Thank you very much, Mr. Chairman. I would like to thank the organizing committee for inviting me here, and special thanks to Dr. Faisal Shaheen, my mentor and teacher. The Qatar population is about 1.7 million. A few years ago, we envied Bahrain because they were double our population. Now we surpassed them. Most of them are actually expatriate workers. Only a quarter of the population are Qatari nationals. You know the incidence worldwide in renal failure and stage renal disease. In Qatar, we see 122 patients per million per year. This is a small part of the patients. The others are being followed by our colleagues, the nephrologists. A larger number of those patients are coming into end-stage renal disease very soon. There is only one hospital, major hospital in Qatar, and that's Hamad General Hospital, and it has the only dialysis centers in the country. There are a few, but they are all under the management of Hamad General Hospital. And there is only one transplant center. According to the World Health Organization, kidney disease is the 5th causer of death in Qatar. All of you have seen this and know that transplant is the best option for patients with renal failure or other organ failures. The transplant started in 1986, long before the passing of the law. And at that time, they were sporadic. They would do like one each year, then nothing for 2 or 3 years, then another one for some time. After the law was passed, it became more regular, but the numbers still small. They were 3 to 4 per year. And we would take kidneys from living and brain death cases. We started organ sharing with Saudi Arabia very recently, and it's a very successful program. Treatment is offered free for the transplant surgery, immunosuppression, and follow-up. For the dialysis, there are charities that pay for the cost of dialysis. Today, we have 505 patients on dialysis. Most of them are on hemodialysis, very few on peritoneal dialysis. And we only have 9 pediatric patients with renal failure. There are 63 patients on the active kidney list, and we would do between 3 and 13 kidneys every year. There are 20 patients on the liver transplant list. The program is active since January this year, but unfortunately, we could not find the best donor to take his livers. There are only 9 patients on the active waiting list of the liver transplant. Now we follow about 80 patients post-liver transplant. Most of these were done in China. This is a small part of the team that works with transplant. This is the surgical part. The hidden soldiers are the nephrology team and the transplants who are not seen in this picture. These are the figures of the East Mediterranean region, and we are way below that in Qatar. Dr. Faisal Shaheen asked me to present a few times before this time, and I would tell him, how would you present 3 cases you do every year? Last year we did 9, so maybe it's a good opportunity to present them this time. And we are planning to do another 4 during the next 3 months. Of the 9, they are about half and half male and female. Most of them, as you see, come from abroad and not from Qataris. We have a rule that passed like 5 years ago that would allow 12 pairs of donor and recipient to come from abroad to be transplanted free of charge. But this is going very slowly. Most of our transplanted patients are between the ages of 20 and 50. Last year we were very happy. 2/3 were done by cadaveric donors and 1/3 from living relatives, mostly brothers and sisters. 1/4 of them developed graft function, the others went very well, and only 2 had complications. One of them is a 50-year-old Filipino who developed a lymphocyte. He elected to go back home in Philippines to do the operation. He did it and he came back with the recurrence. So we reoperated on him, and very fortunately this did not recur, and the last ultrasound was done in May 2011. The other complication was a female patient who was also 50 years old, and she developed a hematoma next to the kidney, and that was resolved within 5 months after surgery. For the 2010 transplants, we have a 1-year patient survival of 100% and 1-year graft survival of 100%. Of course, if we have one complication, this would drop by 11%. Thank you very much.
Thank you, Yusuf. And now I leave the microphone for my co-chairperson to present the next speaker.
The next speaker doesn't need an introduction. Professor Faisal Shaheen, who is Director of Saudi Center for Organ Transplantation. Faisal is a friend, a colleague over the past 20 years. We had a lot of good time, but also sometimes bad times, because he's at the supply end, I'm at the consumption end, and my demands are always very high. But always he's been tolerant to our demands in the transplant programs in the kingdom. Dr. Shaheen is, as I said, is well known. He's actually a member of numerous international and national organizations, as well as he published several papers and chapters and books, more than 100 articles in well-recognized journals. Beside all of this academic and administrative activity, he's dedicated to his patients as a well-known consultant nephrologist and also director of the biggest kidney center in the kingdom. I don't want to spend more time on introducing him. He deserves much more than what I have said.
Thank you, Muhammad. I really appreciate your kind introductions. It's too much for me. And probably I'll start by Chairman, my sister, Dr. Mona, and my brother, Dr. Adnan. And I am a student of Dr. Ghurain, so please don't stop me when I finish. This is what he teach me. So I will take sometimes more time maybe. Today I'm going to speak about our organization in Scott and what we did and what's our result. And probably I will touch again our work in GCC country. This is the Saudi Arabia. Everyone know that we have a very wide area, 2.2 million kilometers, and our population, the recent one, is 27 million. We start by initiating the National Kidney Foundation in 1985, and in 1986 our program started by doing just few cases, and 1993 NKF upgraded to be Saudi Center for Organ Transplantation. This is our place, and we are supervising and coordinating all the transplant activities in the kingdom, in all the hospital, either military or National Guard or Ministry of Health or private sectors. We have our directory, which is considered to be the law of transplantation in the kingdom. Now it is under revision after many years because of the new development in transplantations in the world. So probably our new regulations will be implemented from the next years. We have database for our patients since we start in 1985 and about the renal patient, and now we have database for all the organ failure patients about the transplantations, brain death activities, and supplies, and also urgent waiting list, and all of this we had it in our database. The source of organ donation, this slide is for the kidney. We supposed to have one for the liver, which is a little bit difference between living deceased donors and non-heart beating donor. The major in kidney is 70% is from living donor, and the moderate source is deceased heart beating donor. And deceased non-heart beating donors, only few cases done by Dr. Nizam al-Din and myself. This was long time and we didn't repeat again. Probably in the future we have to implement this and to have some dedicated people for non-heart beating donors. So, excuse me, can I wait for a second? So the total number of intensive care units which we have in the kingdom is 116, and the total ICU bed is 2,276, and emergency service is 324, and we have Red Crescent is 238 center and 681. Why I mention the intensive care? Because again, one of my thoughts, which I think is very important, that if we don't have enough intensive care, we will not have more brain deaths. And one of the targets which we should think about the future to have more donors is to have more intensive care bed, or to have dedicated intensive care like what we have in Spain for the brain death cases. This is the transplant centers. We had 17 for the kidney, cornea, 10, heart, 3, liver, 4, and lung, 2, and pancreas, 2. And this is the renal transplant centers. We think that it's very important to have in the area because too many patients need a kidney transplant in different places. That's why we have in different areas, in south, west, and east, and all the area we have a kidney transplant center there in order to make the transplant in the same city or nearby the patients. We are using the Medivac, which I think is very important for us, for transporting organs, for transporting teams to take sometimes to disease the donors from one area to another facility for diagnosis and also for retrieval. The tool of SCOT is mainly for the medical community about training, curricula, conference, band visit to the hostel, and National Scientific Regulatory Committee in each hostel, and we do a lot of publications for the medical community about transplantation. We have a monthly training program for the people from different areas in SCOT, and this is dedicated for the people, a neurophysician, a neurosurgeon, about the dialysis sometimes, about another activity which is related to the transplantation. And we have manual about the training manual which is being given to each one after finishing this course, which usually take two days. For the public, we make a survey in 86 and 89. We have school visit, especially in Riyadh area. We have a team to go to the school in order to show to them the importance of transplantation. We distribute donor card, and we take any advantage of any conference in order to send SCOT people in order to promote for organ donation. Now the GCC committees we started in the first one was in 1992. And this committee, out of this committee we have a lot. After having this committee, things improved between all the Gulf country, and we have almost every year or every other year a meeting in order to improve our result and our work together. And this is a picture from last meeting. You can see this was in Riyadh in February 2010. And this, I think, one of our important meetings that we have a lot of decision to improve the activities between our Gulf area. By this meeting, we had the first GCC celebrations of the World Kidney Days. This also done in March 2010, because this was, again, something come out from the committee that we should do that. Saudi Arabia taking over, and we did the first celebrations. And also at the same time, we did the first GCC celebration of the World Day for organ donation. This was in October in 2010. And I'm sure that the next country probably will be Qatar and Bahrain. They are going to take over such activities in the future. Again, one of our activities in GCC is to have medical education, and you can see in this picture, you will see Mona is there. She's with us, and she's in the picture as well, and Ali and Frank Domenico and Dr. Awad also. And many other, Dr. Ziad, Dr. Bashir, many others colleagues working there. I was at that time not in this Congress. Dr. Mousawi also here. Now we speak about the trend of the brain death. And if we have any program and it is consistently going on, so we have continuous reporting, this means that program is working. Continuous transplant, this means that program is successful. And I think we have a successful program. And as we can see that this is the trend of the reporting of the brain death. We have median of around 600 cases every year. And this is consent obtained, which again, it seems to be that we a little bit start to be improved, and probably we will have even more better in the future, because we start to have now almost around 115, 120 cases every year. And this is, again, if we look for our